Hello, I'm Boy Eliassen, Director of Health at the Copenhagen Institute for Future Studies and also one of the co-founder of the Movement Health. And with me here I have another co-founder, Rifat Atoun from Harvard University. And Rifat, could you please introduce yourself?
Yeah, thank you, Boy. It's a pleasure to join this conversation. I'm Rifat Atoun. I'm Professor of Global Health Systems at Harvard University. And as you've indicated, I'm one of the co-founders of Movement Health 2030.
And could I ask you, what motivates you in our ambition and aspirations with Movement Health?
The mission of Movement Health 2030, it is trying to bring together all the actors in the health system, but actually across multiple sectors to address societal challenges. And to do this at scale, to ensure that the solutions that are being developed are not just benefiting a few, but actually benefiting everyone, especially those who have the greatest need. And in Latin America, this is a huge problem where huge inequalities exist in relation to income, in relation to life opportunities, in relation to access to healthcare, but also in relation to outcomes. So Movement Health is designed to address these inequalities that exist in Latin America, but at scale.
So in Latin America's health system, sometimes they lack data about public health, both in terms of healthcare issues people are facing and how healthcare systems are functioning. How does this impact HCP and in turn patient outcomes?
But there are a lot of data. Mm-hmm. As the Ancient Mariner poem says, water, water everywhere, but not a drop to drink. So we have data, but we're not able to use the data because they're not integrated, they're not linked, they're not made available, and they're not analyzed to inform policymaking and decisions.
And how is Movement Health making Latin American healthcare more data-driven?
Digital data or lack of digital data and digital health solutions was identified consistently as a major challenge in the 9 countries where Movement Health is currently working. So that became one of the priorities that Movement Health is focusing on. Both development of data systems, secondly, development of analytic solutions that enable the use of this data, third, application of data and digital health into digital solutions, and fourth, again, one of the priorities to ensure that regulatory environment changes in such a way as to make data more available. Of course, not ensuring that data privacy and security are appropriately observed.
Thank you, Rifat. It has been a pleasure to hear you explain and give us depth into Movement Health. And I'm really looking forward to, together with you, to engage with different stakeholders and move this forward.
And thank you, Bogi, for this opportunity. And just reflecting, it's less than 2 years, and now what has started in Latin America has become a global movement, truly to achieve change.